In this video, we're going to show you a beard hair transplant that we performed on my wonderful patient. Watch till the end and the patient will tell you about his experience right after surgery. The patient is a 27-year-old young man who is an engineer. He was bothered by thinning of his bilateral cheek hair, especially the portion that was closer to the center of the face. We discussed a hair transplant to improve this area. Importantly, I had to make sure that he didn't need a hair transplant for his scalp because the donor supply is actually the same, and as we know, there's a limited donor supply for all of this type of hair transplant work. And so if someone is in need of a hair transplant for the scalp, then we ought to focus on that before investing a lot of the donor hairs into the beard area. The donor area for this patient was the back of his scalp, which is the most frequent area that we take from for beard. We decided to avoid the chin area. So there was a discussion about improving the goatee area, but I told them about the risk of cobblestoning that can occur with the chin. And cobblestoning is essentially these little bumps that you can get in the chin area. It's just that the skin texture and type is just different in the chin. And so all patients who get beard hair transplants need to be aware of that heightened risk for when you implant the hairs into the chin area. So we decided that for his aesthetics and his goals and risk tolerance that we were just going to avoid that chin area. Now let's talk about graft count. So normally each cheek, depending on how many pre-existing hairs it has, can consume about 600 grafts. That's a good general number to think about per side. Now if someone has a lot of pre-existing hair, like our patient does, it then requires less hair to make the whole area look cohesive. Because of our patient having a fair amount of this pre-existing hair in the vicinity, and because of the curly nature of his hair, and we know that with curly hair, each hair will take up more surface area, we decided to not do the full 600 grafts per side, but my predicted estimate, based on what I was seeing, and again, I was meeting him virtually since he was coming in from out of state, my prediction was 700 grafts total into the medial cheek, as well as connecting it up with his mustache. Please make sure to subscribe to this channel, and the uncensored version of this video is up on our Patreon, so check out the description below for that link. On the day of surgery, the patient took the usual medications. We always give an antibiotic, we give a steroid pill for inflammation, we give Valium and Ambien to help people feel more relaxed during the surgical process. We also did the typical consent forms, and then we moved into marking the patient. So when I mark patients, I always try to make the two sides as symmetric as possible, realizing that there are always inherent differences in just the three-dimensional architecture of the face that make it impossible to fully match things up perfectly. So patients need to understand that, but of course we're trying to make it look as symmetrical as we can within reason. We do sometimes purposefully try to introduce some asymmetry if it looks almost too perfect, because for a natural result you don't want for it to be perfectly symmetrical. And as far as cheek design, of course people have different preferences, but whenever possible we try to meet the medial cheek to about the level of the oral commissure. That's this portion right here, this portion of our mouth, and so the mustache and the cheek usually will connect around that zone. I had two amazing hair technicians working with me that day, and we then proceeded to numb the patient, right? So with numbing, we take a more concentrated solution of lidocaine with epinephrine, and then we come in with what's called a tumescent solution, where we have a more diluted concentration of our lidocaine to reduce the risk of toxicity, and we have other elements within that tumescent, so a higher concentration of epinephrine to reduce bleeding, as well as usually a steroid in that mix to help cut down on inflammation. Once the numbing is in, then we disinfect the area with betadine. For beard hair transplant, we usually will start with making sites first. The reason to do that is to be as accurate as possible for when it's time to get grafts and do the punches on the back of the scalp. So when we're looking for as accurate of a number as possible, we start with sites first. And in this situation, for our patient, we actually had a higher than originally planned number of sites. And that is because the area, once we started making sites, we realized can actually hold more grafts. So we went ahead and did more. And there are special forms that patients sign, usually the day of the procedure, sometimes in advance, to give us permission to go above our predicted number if the situation should arise. And we always confirm again day of with the patient to make sure they're willing to do that. So that is a unique type of situation, especially for areas that are a little bit more difficult to gauge, such as beard, such as eyebrows, things of that nature. As far as the size of the sites, now when you're starting with the sites first, you don't actually have your grafts to test against the size of the site, which can make it a bit tricky. So you have to rely on experience and just on knowledge of that hair type, basically do an educated guess on the size of the site. So we had a good sense that a 0.8 millimeter site size was going to be appropriate for our patient's hair. And when you're making sites for the beard, it's important to consider the angulation of the site as well as blending things in with the surrounding hairs. So as far as angulation, usually the angle is fairly acute to the face because that's the exit angle of the hairs naturally. So we have to follow that when we're making our sites. Also, you want to blend it in with the hairs around. You don't want to have just an area that's only the transplanted zone and then it looks very distinct from the surrounding hair. So blending it in with the other hairs in the zone is very important. So once we created our sites, then it was time to get the grafts from the back of the scalp. And so we shave the area, we again disinfect the area, and we numb the area. We then proceed to using a punch. I use the FUE system, as most of you know, by Devroy. Jean Devroy created this system in Belgium, and it's a wonderful punch system that is an oscillating type of mechanism that is very gentle on the grafts and is just what we use in this practice. And so we used a 1.0 millimeter punch. That, in our experience, is a very good size for most curly hair types, and so that's what we used in this situation. When we use the 1.0 punch, what we're doing is the FUE type of extraction method. That's follicular unit extraction, where we're getting one follicle, one graft at a time, right? And each graft has a different number of hairs associated with it, anywhere from 1 to 4 hairs per graft. You can see as the grafts come out, they almost look like these little shrimp, which is maybe a little disgusting, but also what we joke around about sometimes. And my technicians then, once we had all the grafts, went on to carefully insert one graft at a time into each of the sites that I previously made. And so when you're putting these grafts in, it's important to keep them slightly elevated above the skin level, because if you make it super flush, then sometimes you can get pitting in the skin. So keeping that elevated graft just above the skin level is important for ultimate healing. Also, when placing these grafts, it's a difficult technique because the cheek has a lot of movement, right? Compared to the scalp, which is a little bit more fixed in place. So with the cheek moving a lot, when you're putting these grafts in, it's definitely more of a challenge for insertion, and the grafts need to be handled with a lot of care. Now, there are times when we had to add in some more sites into the recipient area because we just felt that for better packing of the region, we had to add in a few more in between grafts, and that comes up from time to time. So the total number of grafts that we ended up putting in for this patient into the beard was 900 grafts total between the two sides. Now, as far as post-op care is concerned, the most important thing for beard hair transplants is to keep the area dry until the 6th day. At the 6th day, you can shower, get it wet, start to work out the crust. But we prefer to not do any wetting of the area with a spray or no water over the head until day 6 because of the acute angulation of the hairs and the high risk that they can start to slide out or they can be dislodged if they're wet and if they're manipulated. So it's definitely also important with these procedures to be very careful when brushing your teeth after the procedure, when eating, and also as far as mask wearing is concerned, we prefer whenever possible to tell people for 72 hours after the procedure to really avoid putting on a mask, since it's going to sit right on the grafts and can be a bit risky for removing the mask, putting it back on, that you might dislodge some grafts. We also tell people to obviously not rub the area. Oftentimes throughout the day most people are touching their face, and so it's something that you have to be very conscious about in the recovery for this type of surgery. The donor area, as you see here, we just coat with an antibiotic ointment, and patients continue doing that for the first 4 or 5 days. You can already see at the end of the day it looks really good, and it looks like not much was done. And then the hair that we didn't take, right, but that we just shaved down, that's going to start to grow in pretty quickly and cover up any small tiny holes from the FUE that were created. At the end of surgery, this is what my patient had to say.
Dr. Linkov is very professional. It's smooth sailing. I was nervous when I first came in, but it was better than I thought, because I thought I was going to be hurting. Yeah, that's it.
Patients often come to the office nervous for surgery. That's absolutely normal. But what they find is that by the end of the procedure, they're like, that really wasn't bad at all. And it's usually a pretty good experience. We have a great team, and we keep people very comfortable throughout the day. So I know you like this hair transplant showcase, and you'll really love our video on Elon Musk's hair transplants. Check it out, click on this link, and I'll see you there.